I'm your host, Karina, Virtual Engagement Manager at Plant Powered Metro New York. Thank you so much for joining us for the fourth session in our month-long series, Women's Wellness and Food, Reproductive Health Through the Lifespan. At Plant Powered Metro, we are dedicated to your health and empowerment, providing evidence-based nutrition education and support for meaningful and sustainable lifestyle change. We're so glad you've joined us for this important conversation about nutrition and urogynecological health. If you are curious about the role of diet in preventing and managing urinary and pelvic floor issues and discovering the best foods to support bladder, kidney, and pelvic health, then you are definitely in the right place. Get ready for an engaging and informative session, one that offers science-backed solutions and real-world strategies to help you thrive. Special thanks, as always, to our collaborating partner for this series, Dr. Nasolo Teddy and the HeartSmarts community joining us tonight. The HeartSmarts community inspired us to create this project together. Dr. Teddy will be moderating the Q&A later this evening. Please put your questions in the comments or the chat section, and we will get to them shortly. Our wonderful and kind of famous speaker this evening is Fiona Lindo, a board-certified physician in obstetrics and gynecology who specializes in urogynecology and surgery. She received her medical degree from Ross University School of Medicine and did her internship and fellowship at Yale University's New Haven Health, Bridgeport Hospital. She's a medical director of urogynecology with Willowbrook Hospital and practices at Houston Methodist Urogynecology Associates. Dr. Fee also works with Houston Methodist Center for Restorative Pelvic Medicine. She recently received the prestigious 2023 AMWA Inspire Award, which celebrates accomplished women in medicine who exemplify the highest values in vision, integrity, service, and collaboration. Dr. Lindo embraces a faith-based, holistic wellness approach, incorporating mindfulness, mental well-being, movement, and whole food plant-based nutrition. For many years, Dr. Fee has also traveled with a team of Houston Methodist urogynecologists to Pinyon, Haiti, to perform free surgeries for women suffering with severe pelvic floor disorders and sharing knowledge, tools, and equipment with local providers. One of that team's specific goals was to train local physicians to be able to diagnose and treat pelvic floor disorders so that Haitian women can receive care even when the team is back in Texas. Tonight, Dr. Fee will dig deep into how we can prevent and manage urinary and pelvic floor issues and discover the best nutrients to support bladder, kidney, and pelvic health. Please put your questions in the comments section, and we promise we will get to them. We are so happy to introduce Dr. Fiona Lindo and to have you with us tonight, Dr. Fee.
It's so great. Thank you so much. Thank you so much for having me to be here tonight. And I'm really excited. This is like a topic that I'm very passionate about. What's better than talking about food? I'm a foodie. I love to eat. And, you know, how to take care of your pelvic floor. So combining these two topics that are dear to my heart is a pleasure. And so, you know, before I begin, I want to, first of all, I have no disclosures. And secondly, I wanted to talk about just a little bit about what a urogynecologist is. So a urogynecologist is an OB/GYN physician who has completed a residency in obstetrics and gynecology, but then goes on to do further training, a fellowship training in urogynecology for 3 years. And so we really focus specifically on pelvic floor disorders. We don't take care of cancer. It's all benign issues. And so I wanted to just give that kind of background so you understood what a urogyn is, as sometimes people just don't know. And so this is a specialty that really focuses on the pelvic floor. And so I do have some slides. I'm not sure if we're able to pull those up. Let's see here. What are some of the things I'd like to talk about is, you know, we're going to define what pelvic floor disorders are. and give an overview of what the most common types of pelvic floor disorders. And then I want to discuss the impact of nutrition on pelvic floor disorders, specifically on the most common types of overactive bladder and bladder pain syndrome, bowel dysfunction, and prolapse. And so we'll get into those topics here in a second. And then I'd like to be able to talk about, just give you some resources that you can use and some tips to helping get access to care if you do happen to have a pelvic floor disorder. All right, so I think we're having issues here with the slides, but we'll see if we can, I can just talk about it. So the topic of the discussion today is what is going on below the belt. And so as you can imagine, we want to talk about the pelvis. And I had some pictures here about what really is going on in the pelvis. There's so many things that can happen when things go wrong there, because there are actually 6 systems within the pelvic floor. We have our reproductive tract, the urinary tract, the GI and bowels system, your muscles and your skeletal system, as well as your neuro system. So you can imagine all these systems are happening right below the belt. And when things go awry, any of these systems can be impacted. And when we talk about pelvic floor, we need to think about what are the functions of the pelvic floor. And really, there's quite a few functions that the pelvic floor and the pelvis has. It gives pelvic organ support. It helps with bladder and bowel control, helps with being able to pass urine and control urine, as well as pass your stool and control stool. It helps with sexual function. Also, the pelvic floor helps with breathing, standing upright, sitting down, as well as, of course, during pregnancy and childbirth. And so pelvic floor disorders encompass a group of disorders that affect the pelvic floor due to weakened or injured pelvic floor muscles or connective tissue. And so when that happens, you can have symptoms of having urinary urgency, frequency symptoms, overactive bladder, which is one of the most common ones. You could have a loss of urine by accident or loss of stool by accident. You can have loss of support of the actual organ, so having your uterus drop or your bladder drop to where it comes to the outside. You could have an abnormal communication between the bladder and the vagina, which we call like a fistula, where you then have just continuous urine leakage. Or you could have bladder pain syndromes and interstitial cystitis, which really causes you to have a significant pain and discomfort in the bladder. So all of these can encompass pelvic floor disorders. And about 25% of women experience pelvic floor disorders in their lifetime. And so at least 25% will experience at least one of these pelvic floor disorders. And actually, the prevalence increases with age. So we find that nearly 50% of women, by the time they become to the wise age of 80, have at least one or more pelvic floor disorders. And so we talked about some of the common ones. Overactive bladder would be the highest incidence when it comes to pelvic floor disorders, followed by stress incontinence, urinary urgency incontinence, as well as bowel leakage, and then pelvic organ prolapse. So it looks like that my slides unfortunately aren't going to be able to be shown tonight, but we'll just have a discussion, and the slides we'll be able to send out to you after this talk. So when we talk about pelvic floor disorders, we want to look at it on the span of like a woman's life. And so really, during the lifespan of a woman, different pelvic floor disorders can develop based on where they are in their lifespan. And so between the ages of 25, 30s, that's when really a lot of pregnancies occurring, deliveries. And so women can experience childbirth injuries, and then also can have urinary leakage, Recurrent bladder infections, bladder pain syndromes can start around this time, pelvic floor muscle spasms, and constipation. And you'll see that there's like a theme, like there's common things that can occur at each of the time points, and then some things happen more often depending on what time point you're at in the lifespan. And then around the perimenopause, menopausal time period, you have urinary incontinence that can develop, significantly stress incontinence, overactive bladder. You can start, if you're coming in that perimenopausal, menopausal time, you can come to have what we call genital urinary syndrome of menopause, which is really a complex of symptoms that can occur when you are lacking estrogen. And so symptoms of burning, itching, discomfort, painful intercourse occurs. And then during this time period, you can also have prolapse or constipation again. And then as we get further along in the time, in the lifespan, 70s up, again, all of these pelvic floor disorders that I've mentioned, including accidental bowel leakage and then vulvar skin disorders. And so when we talk about pelvic floor disorders and the perceptions that women have with these disorders, it really encompasses a whole, it affects all aspects of their life. So it affects their physical, impacts their physical activity, impacts on sleep and sexual activity. It also affects their body image. And a lot of times women really struggle with efforts to feel normal when they have some of these disorders. And not all effective women actually report that they're experiencing these symptoms. And they often are scared to do so due to stigma or just feeling embarrassed about these things. And then when we talk about some of the risk factors for pelvic floor disorders, one of the major risk factors is really having a baby, being pregnant and delivering a baby, because what happens is your pelvic floor muscles can be stretched or injured during that time. And then again, you can have if you have a risk factor of obesity or excessive weight, can really put a lot of strain on the pelvic floor muscles and cause support issues. And then increase of any increased chronic abdominal pressure, and that would be chronic constipation, cough, any asthma, things that cause you to really have a lot of increased pressure on the pelvic floor. Also, like heavy lifting can also be a risk factor. And when we look at symptoms of obesity, what we find is that, obesity can have a significant impact on your urinary leakage symptoms, because what we find is that those who have obesity have about 4 to 5 times higher risk of having urinary leakage. And what we see that even just a small amount, 5% of the current weight of someone, can actually result in 50% decrease in their stress urinary leakage symptoms and 73% reduction in their overactive bladder symptoms. And so what we see is a combination of diet, physical activity, movement, medications have proven to be effective in reducing leakage by 40 to 50%. Other risk factors are age, genetics, as well as history of pelvic surgery, maybe nerve damage, or certain medical conditions like diabetes can also contribute to pelvic floor disorders. So when we talk about pelvic floor disorders, what are some of the symptoms that you can have? And so there are different symptoms, because remember we talked about there's the different systems within the pelvic floor. And so you can have vaginal symptoms where you have pressure, where you have heaviness or a bulge. You can also have urinary symptoms. And the urinary symptoms include urinary urgency, frequency, leakage, and you can have symptoms of sexual dysfunction, pain with intercourse, having difficulty with dryness and irritation or pressure. And then, of course, bowel symptoms, which involve pressure, having urgency, incomplete emptying, accidental bowel loss of contents, as well as gas, or even blockage, or having to use your fingers to push to help empty your bowels. And so there are psychological symptoms along with pelvic floor disorders. And as I mentioned earlier, women that suffer physical and really emotional distress because they feel more self-conscious, they feel less physically attractive, less feminine, and less sexually attractive. And what we found is that there are some great, simple, powerful therapies that can be used when we look at in lifestyle medicine. We're seeing utilizing some of these 6 pillars that include nutrition, sleep, movement, removing substances, harmful substances, social connection. All these things are very helpful in treating disorders. And we're finding that we're implementing some of these therapies in obstetrics, in reproductive endocrinology, and general gynecology, and gyne-oncology, and now in urogynecology. And if I had my slides, I'd really be excited to show you some great pictures here of how we can apply these principles to a urogynecology patient or someone who's having symptoms of pelvic floor disorders. And tonight, what we want to really focus on is the impact of pelvic floor disorders, the impact that nutrition has on pelvic floor disorders. So we're really going to be focusing on this talk on nutrition, whole food, plant predominant eating, really eating high fiber, eating from the rainbow, and how that has a significant effect on pelvic floor disorders. So the first disorder I'm going to talk about is overactive bladder. And so when you think about overactive bladder, it's that gotta go feeling. You feel that urge, you gotta run to the bathroom. Sometimes you make it, sometimes you lose urine on the way. And when that happens, frequently, sometimes you can have either, you're noticing that you're frequently running to the bathroom, more than 8 visits to the toilet in the 24-hour period, or you're getting up quite a bit at night, more than 2 times at night. And that's accompanied by the urgency and then sometimes sudden loss of urine. And what's happening in the bladder when this is happening? So, we don't know all those true causes, but some of the things that we know is that it's definitely a neuromuscular problem. We have that the muscle in the bladder is contracting inappropriately while the bladder should be remaining quiet as it's filling. And these contractions occur regardless of the amount of urine in the bladder. And there are a number of different causes, both neurological issues and non-urological issues that could be causing this. And what we're seeing is that also other factors that can contribute to an overactive bladder is oxidative stress, systemic inflammation, insulin resistance, and just chronic inflammation of the bladder epithelium. So you can kind of see where I'm going with this, that inflammatory states that is associated with this, and we can see how nutrition can really make a significant impact. So when we look at how overactive bladder affects one's quality of life, we see that those who have that, they're having to bathroom map, trying to make sure that when they're going out, they know exactly where the bathrooms are. Or they're packing extra clothes or pads, wearing darker clothing in case they have an accident, skipping social events, limiting fluids so that causes them to have dehydration, chronic fatigue by getting up all the time at night, and then even social isolation. So you can see that can have a significant impact. And what we find is that there are our first-line therapies for treating overactive bladder and urgency incontinence actually involve lifestyle interventions, primarily removing bladder irritants. Well, you might ask, what are bladder irritants? Bladder irritants include, and if I had my slides, you'd see a big picture of a cup. So if you have a cup on your desk or anywhere nearby, ask the question, what is in your cup right now? And so when we talk about bladder irritants, the common irritants we talk about is caffeine, so caffeinated beverages like coffee, tea, soda, carbonation, alcohol, artificial sweeteners. Those are the common things. Sometimes with women, if they have painful bladder syndrome or interstitial cystitis, certain foods like citrus foods, dairy products, tomatoes, and spicy foods can cause significant discomfort and overactivity of the bladder. Well, there was a study that focused, that was published in Neurourology back in the mid-2000s that looked at the nutrition composition of the diet and the development of overactive bladder. And this was a big, large, longitudinal study looking at over almost 6,000 women. And what was found was that there were certain nutrients that, if missing, actually had a significant effect on overactive bladder symptoms. And now, drum roll, what were those nutrients? Well, one of the first ones was vitamin D. So vitamin D deficiency was linked to an increased risk of overactive bladder and urinary incontinence. And what we find is that vitamin D plays a really big role in muscle function, including around the detrusor, which is the bladder muscle and pelvic floor muscles. And there are, when we saw that there was higher intakes of vitamin D, so those women who had higher intake of vitamin D actually had decreased symptoms and incidence of overactive bladder. And so can you get your vitamin D from? Well, mushrooms, fortified foods like plant-based milks, tofu. You can also get vitamin D from citrus and some green leafies, or just the good old sun, getting out in the sun and getting some good sun exposure. So one of the recommendations is to make sure that you maintain adequate vitamin D levels through sun exposure, diet, or supplements as part of a holistic bladder health strategy. Now, the next nutrient that was noted in the study and other studies was potassium. And there have been some studies that show using potassium to help with treating overactive bladder. And so what they found was there was one study that looked at about almost 100 people, and it was a randomized controlled trial looking at the effects of potassium citrate, so giving basically supplemental potassium. And what they found was that the potassium treatment actually improved overactive bladder symptoms, and they found it even more of a significant improvement in elderly patients. And so how do you get your potassium? Eating vegetables, leafy greens like kale, lettuce, cucumbers, squash, potatoes, broccoli, carrots, celery, bell peppers, all those fun foods that are high in potassium. Utilizing that, getting that in your diet is going to help with overactive bladder symptoms. The third nutrient that was found in the study was actually protein. And so what we found was that incorporating plant-based proteins and isoflavonoids like tofu and name legumes, they can be beneficial to help with due to their anti-inflammatory and antioxidant properties. So beans, lentils, chickpeas are really high in fiber and protein and really contribute to the overall digestive health, which really helps with the bladder health. Nuts and seeds like almonds, cashews, peanuts, sesame, flax, and chia seeds also have protein and other good fats that can help with decreasing inflammation. And so when we talk about bladder pain syndromes is really like a chronic condition kind of characterized by the bladder pain, pressure, urinary frequency, urgency, and it's it's someone that has this chronically without an infection. And what we have found is that nutrition really plays a major role in managing these symptoms. And so we talked about some of the foods that can cause effect. There is some relief with aloe vera, which is a plant, and quercetin, which is also a natural anti-inflammatory that really can help with reducing inflammation and supporting bladder health. So I want to move to stress incontinence. And I think at the end we'll have some time for questions. So really write your questions out And again, I'm sorry that we don't have any visuals, but I'll try to be as descriptive as possible. When we talk about stress incontinence, it's really as a result of loss of support of the muscles in the pelvis and really underneath the urethra, which is the tube that drains the bladder to the, drains the urine from the bladder to the outside. And so when you cough, when you sneeze, when you laugh, you have some loss of support and you can have leakage. And when we talk about stress incontinence management, we really are looking at strengthening those pelvic floor muscles. But as we talked about earlier, weight loss is key. And when we talk about that, we really want to pair nutrition with exercise or increased physical activity and pelvic floor physical activity as well to help with treating stress incontinence. But one of the really important things is making sure that you are having regular bowel movements, and you can do that by eating a high fiber diet. The other thing would be, quit smoking. If you are smoking, that really has an effect on your pelvic floor muscles and can contribute to overactive bladder and stress incontinence. And then there are ways that we can further treat stress incontinence non-surgically with using a vaginal insert or a pessary or surgical options. And I will say that throughout this talk, all of these conditions, there are further therapies and treatments that can be used to treat them. But for our focus and topics today, we're really focusing more on the impact of nutrition. And so what is the impact of nutrition on stress incontinence? It's really weight loss. Rather than just increasing exercise is a critical factor in improving urinary incontinence. So as I mentioned before, studies show that losing just 5% of your body weight can significantly reduce stress urinary incontinence episodes. And what we have found that there have been several studies that kind of looked at the impact of nutrition on weight loss. And there was a 2020 meta-analysis that was published in the journal Diabetes, Metabolic Syndrome and Obesity, found that plant-based diets led to significant weight loss, even without calorie restriction. So you could eat what you'd like, whole food plant-based, and what they found was with the adults that were in that arm actually lost an average of 11.5 kgs or 25 pounds over 6 months without any other trial without any calorie limits or mandated exercise. And so you can see how nutrition can have a significant impact on weight loss. And then another study in 2022 highlighted that whole food plant-based diets were really effective in reducing the BMI, especially when combined with behavioral interventions. So these are all positive things that really direct having nutrition being having a significant impact on the bladder. And when we look at leaving from the bladder here, we're going to talk a little bit about pelvic organ prolapse. And pelvic organ prolapse is really weakening of the levels of support of the pelvic floor, and which result in symptomatic or palpable visible bulge from the vagina. And there are different compartments. So you have your anterior compartment with the bladder sits on. You have your apical compartment, which would be where the uterus, or if you do not have a uterus, the top of the vagina. And then your posterior compartment, which is where the rectum lies. And you can have bulges of one or more or all of these compartments at the time. And as I mentioned to you before, one of the major risk factors for a prolapse would be having vaginal deliveries. And the lifetime risk for surgery for pelvic organ prolapse is about 11%. And we find that there is a high incidence of women who are experiencing pelvic floor prolapse. And one of the ways that we can treat or prevent prolapse through conservative management would be really education, reassurance, pelvic floor physical therapy, vaginal estrogen, pessary use, which is like the vaginal device that can hold some support, but then also constipation management. And so this is where I'd like to talk a little bit more about constipation. And this happens when the bowels do not move easily or regularly. So you have decreased bowel movements, fewer than, if you're not having a bowel movement daily, potentially, and you're still having, your 3 full meals a day, then you want to start looking at some ways in which we can get those bowels to move. Why that's important is that the bowels, the nerves that go to the bowels and the bladder are very similar. And so as your bowel is not listening to the brain, telling it to empty, your brain is really taking that message, and you will have more overactivity of the bladder. Sometimes you can have difficulty emptying your bladder and other symptoms just due to not emptying your bowels. So that's why it's so important. Also, symptoms of bloating, straining, and incomplete bowel emptying can occur. And common causes are low fiber diet, lack of increased physical activity, dehydration, just ignoring that urge to have a bowel movement, or changes in life or routine, some medications and some medical conditions like stroke and maybe even colon and rectal problems can cause you to have constipation. But the impact that nutrition has on constipation is huge. And so if I was to ask the question, what do you think is the number one factor in helping the bowels move? If I could hear you, I think that you'd be saying fiber. And so fiber really is the MVP for bowel health. And so what we find is that a diet that's low in fiber and fluids or high in processed foods and fats can significantly contribute to constipation. While a diet rich in fiber and fluids, along with regular movement, can really help prevent and treat it. So fiber really is the most important thing here. And there are different types of fibers. So what we want to do is aim for having at least 25 to 30 grams of fiber a day to help with keeping your bowels moving with fluids, because if you just have fiber without water, then it will harden your stool. So you want to make sure you're drinking plenty of water. And then whole food plants really are great because they're naturally high in fiber and water and promote regularity with your bowels. So you have soluble fiber and insoluble fibers. And soluble fibers are important. So things like legumes, beans, they're excellent source of fiber. Apples, whole grains like oats, nuts, and then vegetables. And there are some really great natural laxative foods. So we all have heard of prunes. And so we know that prunes, they contain fiber and also sorbitol, which is a natural sugar alcohol that has laxative effects. And then kiwis and figs have also shown to have positive effects. There was a randomized controlled trial that was done in clinical nutrition in 2020 that showed that just 2 kiwis a day can significantly improve bowel habits compared to psyllium husk. So if you don't want to, use that Metamucil, then grab 2 kiwis. That can also help with your bowels. And then, of course, flax seeds are excellent. Ground flaxseed, just a table of ground flaxseed in your salads or your smoothies can really give you that good fiber content. And chia seeds. So those are some other foods, of course, along with your fruits and veggies that can really help with improving your fiber intake. So I had a little quiz. And so the question was, what are the best sources of fiber? And so if I was to ask you, just kind of think about it. What are the best sources of fiber? I'm going to give you some options here. Is it A, green leafy vegetables? Is it B, whole grains? Is it C, root vegetables? Or D, legumes, beans, lentils? Or is it fruit? So what do you think? And there's actually 2 main answers here. So kind of like a trick question, but really how you can get the best sources of fiber is going to be with your whole grains and your legumes. So your beans, your lentils. And the reason why that is that your leafy green vegetables and fruits are really 90% water. They're great, but root vegetables have more fiber. And the fiber superstars really are the beans, the legumes, split peas, chickpeas, lentils, and whole grains. And so it's important to incorporate these into your diet. Now, the other food source I think that's going to be really important in helping manage constipation is magnesium. And magnesium helps to attract water into the colon to soften the stool. And you can find magnesium, there's magnesium supplements. Magnesium helps with bladder spasms. It's also good for restless leg and anxiety, and helps with sleep. So it really can help with a lot of different things. And there are foods that are really high in magnesium, like pumpkin seeds, chia seeds, almonds, black beans, avocado. Um, uh, then there's bananas and whole grains. All of these things have high levels of magnesium that can really help. There are certain fish as well that can be a good source of magnesium, and then dark leafy greens. And so magnesium is also an important component when it comes to having healthy bowels. So the next topic that I want to just briefly talk about is accidental bowel leakage. And accidental bowel leakage is one that really can cause a lot of distress for those that experience it. What it includes is having either gas leakage or actual bowel, maybe small amounts, or complete loss of control of the bowels. And this can affect to 7 to 15% of women. And we think those numbers are low because, this is a topic that people really don't like to talk about. Other symptoms can be bowel urgency or passive leakage of stool. And when this occurs, what we find is that there are some really great first-line therapies that can be done that can have significant impact on loss of stool by accident, which we call accidental bowel leakage. And some of the things that we do, one of the first things, some behavioral modifications would be, removing things that eliminate that really affect the bowel. So like bowel irritants. And they're quite similar to the ones that we talked about for the bladder. And so bowel irritants, including, caffeine, caffeinated beverages, alcohol, artificial sweeteners, spicy foods, fried or fatty foods, dairy products, high FODMAP foods. And so when I think about bowel irritants, so when we talked about bladder irritants, the question was, what's in your cup? So when you think about bowel irritants, my question to you is, what's on your plate? And so looking at identifying these foods that are going to be causing irritation in the bowel is so important, coupled with an increase in your fiber intake, making sure you're having adequate fluid, and then, using exercising those muscles in the pelvic floor. Really, bowel retraining and helping with like timed and urge suppression, as well as strengthening those pelvic floor muscles, are so important in helping with accidental bowel leakage. And of course, with any of these different things, if you are having those symptoms, I'm going to encourage you to seek one of us out to help with those. And so nutrition has a significant impact on accidental bowel leakage. And dietary changes can significantly reduce the frequency and severity of these symptoms. Now, clinical guidelines, they recommend, as I mentioned, dietary modification as the first-line therapy for conservative management. And a study that was published in Gastroenterology found that dietary changes, including elimination of trigger foods, significantly improve accidental bowel leakage episodes in adults. So, keeping a bowel diary, so identifying, figuring out, what you're eating at this time and when it causes those symptoms, are helpful to identify what those triggering foods are. And some of the things that can really help, like the goal really of nutrition on accidental bowel leakage is to really improve your stool consistency. So help to create well-formed bulky stools that are easier to hold and less likely to leak. And then also helping to reduce diarrhea and bowel urgency. So those would be minimizing foods that stimulate the bowels or create loose stools. And then really important, managing constipation, because if you have constipation, you can have overflow bowel leakage that is caused by too much stool buildup. And then it's important for you to identify personal triggers. So being able to customize what you're eating based on your own individual response. And then also supporting gut health, adding probiotics found in live cultures like kimchi or kefir, prebiotic foods like garlic, onions, bananas, oats. They really help to support the bacteria and have a healthy microbiome. So the next area, I'd like to just mention is the management of genitourinary syndrome of menopause. And when we talk about this area, I want to talk about it just because it's something that I would say is probably not talked about, not realized a lot, and just treating this can really help with a lot of symptoms that women may be experiencing when it comes to their pelvic floor disorders, specifically in the menopausal time and perimenopausal time periods. So genital urinary syndrome of menopause include genital, sexual, and urinary symptoms like itching, dryness, urgency, frequency, burning, recurrent urinary tract infections, and even vulvar and vaginal atrophy and discomfort. And so when we talk about some of the dietary things that we do to help with some of the symptoms, specifically recurrent urinary tract infections, what we found is that cranberry extract can be used to help decrease the amount of bacteria that builds up in the bladder that can cause an infection. And sometimes people talk about drinking cranberry juice. Cranberry juice really, it would have to be the pure cranberry juice. About 11 glasses is equivalent to the extract, 1 capsule. So I think the extract is probably going to be a little bit easier. But studies have shown that it does decrease the incidence of urinary tract infections. The other thing is sometimes when someone has continuous urinary tract infections, removing meats that have extremely high bacterial load, like chicken, from the diet can help with reducing those infections. But there are some non-hormonal therapies that can be used to help with some of the symptoms. And so here we're talking about our natural oils like coconut oil, olive oil, vitamin E or vitamin D suppositories, and even like water-based moisturizers. So these are moisturizers that can be very helpful to use on the outside after your shower, or even on the inside, or even using some of these oils during intercourse to help with for lubrication can be really helpful. Hyaluronic acid can be helpful as well inside the vagina and the vulva to help with those dryness symptoms. And there are some further modalities that your provider can discuss with you, such as laser and other things that can help these symptoms. And then, of course, there's vaginal estrogen that can also be used to help as small doses that are used in the vagina to really help to treat this discomfort. And sometimes this is all a woman is experiencing. It really can have significant impact on their quality of life and fixing some of these symptoms that occur with genitourinary syndrome of menopause. So that was a kind of like a introduction of an overview, really, of what are some of the ways that nutrition can have an impact on what's going on below the belt. So now you know what's under the belt there. We've talked about, the pelvic floor anatomy. We've talked about what are some of the systems that are there. We've talked about some of the common disorders that occur, like urinary incontinence, constipation, pelvic floor disorders. pelvic floor support disorders like prolapse, chronic pain, touched on recurrent UTIs. And in conclusion, what we've learned really is that there's a significant impact that nutrition has on pelvic floor disorders. And when we eat for health, we're also making a positive impact on issues below the belt. And so really, the goal really is to eat the rainbow to help with your pelvic floor. Now, one of the things that I'd like to briefly talk about before we open up for questions is what can we do to help, if we have pelvic floor issues, what are some things that we can do? Well, first of all, I want you for all of you to just listen to your body. Know when something's not right, and don't be afraid to speak up about it and see your provider. So speak to your provider about your symptoms. Get to know your local urogynecologist. There should be someone nearby you. And then you want to be resourceful. Look for some resources that can help to improve your health and well-being, so that not only are you making an impact on your pelvic floor, but on your entire health as well. Also, be open to a multidisciplinary approach. You may need to be seeing your nutritionist as well as your gastroenterologist and your colorectal or your urogynecologist or your gynecologist. So be open, or your pelvic floor therapist, which is important. So be open to having a multidisciplinary approach to your pelvic floor disorder if you have. And then lastly, be an advocate for yourself. If you have a problem and you haven't been able to get it solved with one, keep searching and make sure that you're able to get the care you need for yourself. And then get informed. Some great websites and resources for helping with learning more about pelvic floor disorders are voicesforpdf.org and also yourpelvicfloor.org. Those are great resources to help with learning more about pelvic floor disorders and how they can be managed. And then a great website for being able to eat more fiber, which is, I think, a common theme throughout my talk, would be fullplateliving.org. It's a free resource. They have great programs there for you to, and innovative ways for you to incorporate fiber into your daily life. So I want to thank you all for listening. And I know that there are some questions, so I'll be happy to answer what questions that we have.
Thank you so much, Dr. Fee. That was a really fantastic focus on the whole area, the whole below the belt area and the disorders. And there are just so many common things that I've either heard about or I heard, have heard friends talk about, and we have lots of great questions. As we roll into our Q&A, I'd like to introduce Dr. Na Solo Teddy. Dr. Teddy is a local to New York City professor of public health and the founder and director of the HeartSmarts program at New York Presbyterian Hospital. She is committed to educating and empowering communities, and she strives to promote wellness, prevent chronic disease, and address health disparities. Through HeartSmarts, a group that meets on Zoom once a week, she leads a transformative movement that inspires individuals and drives truly meaningful change. Her dedication, expertise, and innovative approach are creating a profound and a lasting national impact. We are proud to introduce this series in partnership with Dr. Teddy and the HeartSmarts program. So thank you, Dr. Teddy. We have lots of HeartSmarts members. Thank you again for joining us. Lots of great questions coming up. And I think we have about 75 people on YouTube and another 10 or 20 on Facebook from as far as California and Trinidad.
Awesome.
That's great.
Thank you, Karina. Thank you so much again for your partnership on this amazing series. And what's really awesome is tonight's session is a great follow-up to last week, and a lot of the questions that we had at the end of last week's session were discussed in the presentation by Dr. Fee. So Dr. Fee, thank you so much for an amazing presentation. Shout out to the HeartSmarts community who are here tonight sharing their amazing questions and comments in the chat. And so Dr. Fee, the first question that we have for you is about how does someone know for example, if they drink a lot of water, if they have an overactive bladder, or if they're just drinking a lot of water, like what would be the difference for someone like that who has that question?
Yeah, I mean, that's a good question. I think when we talk about overactive bladder, we're thinking about, how if you're going to the bathroom frequently where it's disrupting your life. So you're unable to, do activities, you're unable to spend time, at the park with your family or sit and watch a full 2-hour movie. So when we think about, the frequency of urination, when it starts to disrupt your way of life, we can think that maybe then it's causing an issue or a problem. Of course, there's always where you can drink too much fluids. And so being able to kind of adjust, if you are now adjusting your fluids and still having that urinary frequency urgency symptoms, then you may have overactive bladder.
Okay. Is there such thing as an underactive bladder, and what would the symptoms of that be and the causes?
Yeah, that's a good question. And absolutely, you can have an underactive bladder. And that would involve you having your bladder, you would feel like you're not completely emptying your bladder. You may have some hesitancy or difficulty emptying your bladder. Sometimes people have an underactive bladder and unaware of it. And so, but typically, if you have gone for a very long time without emptying your bladder, or you continue to start to have like pressure or feelings of discomfort in that sense, you could have an underactive bladder. So really, the symptoms are more like incomplete bladder emptying and those type of symptoms.
Okay. Do you suggest that women wear panty liners for those who suffer from these issues? And if so, are there certain types of panty liners that you recommend?
Well, I actually recommend if you suffer from these type of issues to go seek a urogynecologist out so you can throw away those panty liners, because there are ways that you can help um, to to not have those symptoms where you need to have the panty liners. So that's what I would recommend first off. But I would just say I don't have any recommendation. I would just say something that's not irritating. Cotton base is typically really benign to the vulvar area. So that's something that one could use, but whatever is you feel comfortable using. But as I said, I would aim to seek out care from a urogyne so that you can throw away those panty liners.
All right. And so can you elaborate more on what FODMAPs or high FODMAP foods are, and for those people who are not familiar with that term?
Yeah, very good. Yeah. So really, these are really sometimes there's foods that can be irritating. So they're kind of be more focusing on like more low fiber type foods that are not as irritating to the bowels. So things like bananas or more soluble fibers, not the fibers that have significant, a lot of like the green cruciferous vegetables like broccoli and cabbage would be more of a high FODMAP. So we wanted to have more of the soluble fibers like berries, whole grains, soluble fibers that can be more easily digestible. So I'd say more easily digestible foods.
Next question is there any truth to the idea that eating a lot of pineapples is good for bladder health and also the smell of the vagina?
That's a good question. I mean, I'd have to look up, I would have to see if there's any research studies on that. I think I've heard that anecdotally, but I really don't know if research actually proves or supports that.
Okay, great. How do you treat prolapse bladder?
Yeah, so some of the conservative ways of treating prolapse bladder would be doing pelvic floor muscle exercises. You can also use a vaginal insert or pessary to help give support in that area. But then there are also surgical techniques, which I didn't cover tonight, that are, and there are different techniques surgically that can be done depending on your stage of prolapse and what type of prolapse and also like the stage of life you are. And we look at all these different things and can come up with a really great option for one that has a bladder prolapse. And so bladder prolapse is more of like a support issue. So if things are hanging out, seeing your urogynecologist, they really do a thorough evaluation of your support, do measurements, kind of see exactly where things are at, and then offer the best option for you. So there's different ways that we can treat that. We can use your body's tissue and do things through the vagina, or we can go through the abdomen and do more of surgery in that sense. So there are different ways that we can do that. And I recommend just, if you do have bladder prolapse or prolapse of any sort, seeing your gynecologist, they will be able to speak with you with the best ways that can treat your issue.
Awesome. All right, Dr. Fee. So over the last 4 weeks, we have all kind of gotten closer because of the topics that we're talking about. And so this is primarily a faith-based community. But what we have found out is many of the participants here who are older are still sexually active, still getting their groove on. And so
Great.
as we talk about the idea of UTIs, are there any tips that you have for people who are sexually active in terms of one, how could that possibly be leading to recurring UTIs, and what can they do to help prevent that from a sexual health perspective?
Yeah, absolutely. And that's kind of touching on what the end of my talk when I focused on genital urinary syndrome of menopause. And I will say that, if you are perimenopausal or menopausal, some great things to do that will help with preventing recurrent UTIs would be getting on a little bit of vaginal estrogen. That's a great and very benign treatment. There have been studies that show that even using small amounts in breast cancer patients does not have any negative effect. And so it's a local application. You're just using that topically. You're not eating it. The black box warning is for oral estrogen, not for topical estrogen that's used in the creams. They're a very small dose. And that's something that can really help. Why it's really helpful in the vagina is that it helps to bring back the natural rugae, the folds, the elasticity in the vagina. It also supports having a healthy pH in the vagina. So the pH in the vagina really should be acidic. And when you become more wise and sophisticated in age, that pH actually rises to be more of a basic and high pH. When you have a high pH, you lose your good bacteria, which are the lactobacilli, and you basically have an overgrowth of the bad bacteria that can cause you to have increased urinary tract infections. And so that's one thing that can really help with preventing that, is that vaginal estrogen or hyaluronic even acid. The other thing that can help if you are prone to having recurrent UTIs is to using a cranberry extract. Sometimes using a cranberry extract before and after intercourse can help. There's also a supplement, which I didn't mention earlier, called D-mannose, which is like a sugar that is doesn't go into your bloodstream. It actually is secreted in the bladder itself and kind of causes a coating around the bladder walls that helps to prevent infection. But I would say that if you're sexually active still, that is great. Make sure you're still getting your pelvic exams yearly, even if you've had a hysterectomy, because you still have a vagina and the vulva and the urethra and the bladder. So just getting a checkup to make sure everything looks great. Using lubrication. One that's really great is coconut oil, because it also prevents yeast. So coconut oil is great to use during intercourse, and it's also great to use as a lubrication on the vulva and inside the vagina. And I think those are the main points I wanted to make on that.
All right. How much magnesium should people be taking, and what form of magnesium supplement do you recommend?
Good question. So I say, at least 250 to 300 milligrams daily. There is a magnesium citrate is one that's quite calming. It also helps with the, it's calming with on the stomach, and it has a significant impact on the bowels, as well as anxiety and restless leg and sleep. And you can do it in oral form with tablets, or in a powder form, a solution. There's some great powders that are on the market that you can get at your grocery store, health food store, but just making sure that you're having some form of supplementation is important.
All right. Should vaginal estrogen be purchased online or only using a prescription from a GYN?
Yeah, so it's typically a prescription. I'm not sure if you can get vaginal estrogen online. I don't think so. It's typically a prescription, and it's important because you want to make sure that you have that low dose. But there are some great vaginal moisturizers that you can get online, like hyaluronic acid, vitamin E or vitamin D suppositories, which also can help with some of those symptoms.
Right. A few more questions. Do vaginal dilators aid in pelvic floor therapy? Are they beneficial to lichen sclerosis? And what foods are beneficial for LS?
Okay, so we're talking about lichen sclerosis, which is a vulvar disorder. Lichen sclerosis occurs as a result of, that kind of autoimmune. As you become more wise and sophisticated in age, you're not making estrogen. So really low estrogen situations when you can have this vulvar disorder. So we see it in prepubertal girls and then perimenopausal, postmenopausal women. And so sometimes what are some of the symptoms of lichens that can occur if it's not treated is that you can lose the architecture of your vulva, you can lose the clitoral hood, your labia minora kind of disappear, and you can get vaginal stricture. And so I think that's what this person's question was leading to. So this is typically lichen sclerosis that is has occurred and is not has been found that after not having a lot of treatment for that. And some people can have where you have loss of the vaginal canal. And so in that sense, working with a pelvic floor physical therapist and utilizing a dilator to help prevent the vaginal walls from closing and stricturing together it is something that can definitely be done. And I would say, for vulvar health is, making sure that you're having an anti-inflammatory diet so to prevent an inflammatory state is going to be helpful and important.
Right. And are there any support groups for LS individuals?
There are. I don't have that resource on me tonight, but I could potentially look something up and send it over. But you could go online and Google and see if there's a lichen sclerosis support group in your area. I would say that there is also a vulvar society that you can look up. Has some really great resources for patients. And then the National Menopause Society as well, NAMS, also has great resources for lichen sclerosis.
Right. Is vaginal training a good idea? The person states that they used to hold their bladder when they were in school, and she felt like it weakened her bladder.
Yeah. So pelvic floor training or pelvic floor exercise is important for all ages, really to help with supporting your pelvic floor health. I think I'm not sure exactly what symptoms you're experiencing with holding your bladder, but sometimes what can happen is that your bladder just gets quite large and extended. And sometimes just doing some time voiding and things can really help with some of those symptoms. I would encourage you to reach out, look for a pelvic floor therapist to help with helping you kind of do those great exercises that will be important. They really are great to work with. They will evaluate your bladder, your pelvic floor, all the aspects of your pelvic floor. We talked about those systems that are there, and really kind of come up with a treatment plan that's for you, that's tailored to you. Kegel exercises, really being able to squeeze that pelvic floor. About 70% of women feel like they're doing a Kegel and aren't actually doing it. So some tips to help you know that you're doing a Kegel correctly is you can get a mirror You can put it there, right? Hold it in front of your vulva. And when you squeeze, you should see that the pelvic, your labial lips are kind of closing. If you push out, you're doing a reverse Kegel in that you're not actually contracting, but you're kind of pushing or bearing down on those muscles. So the actual correct Kegel is to contract those muscles, and you should see those vulvar lips closing in. If they're pushing out and opening up, then that's not a Kegel. So being able to do that, so you can learn. There are some great devices also in the market that can help with being able to make sure that you're doing the appropriate squeeze and not just bearing down and not contracting your pelvic floor. And then, of course, there are some things that there are different types of exercise that are going to be helpful depending on what your condition is. So if you have a hypertonic or a really tight pelvic floor, you don't want to be doing a lot of squeezing and tightening, but more focus on relaxation and relaxing those muscles. So there's a lot of work that the therapist can help you with depending on what your issue is.
All right, and these are the final questions. Can you go over what you said about chicken bacteria related to UTI?
Yeah, of course. So there was some research that was done looking at the bacterial load and the incidence of recurrent urinary tract infections. What they found was that there's a very high, especially E. coli load in chicken meat. And so what they found was when people eliminated that particular meat, they had decreased risk of recurrent urinary tract infections. So I just tell my patients, hey, we've tried all these things. That may be the one thing that you need to try and see if that has an improvement. So it's just something that is an added benefit. And you think about it, if your body's holding a lot of bacteria, especially harboring a lot of bacteria, just trying to reduce that is going to be important.
Right. Does having an episiotomy during childbirth increase your chance of bowel prolapse?
Yeah, so actually, when you think about rectocele or a posterior vaginal wall prolapse, yes, an episiotomy can do that depending if what the repair was at that time. That definitely does increase your risk of having vaginal prolapse of the rectum into the vagina. It also increases your risk significantly if you've had an episiotomy and ended up with a tear or a cut into your rectum, which we call a 3rd or 4th degree tear. That increases your risk significantly for accidental bowel leakage that's seen typically later on in life. And so, yes, those things can definitely, an episiotomy can increase your risk of those issues.
Okay. And does eating oats or oatmeal help with constipation? And how much water should we drink each day?
That's a good question. Yeah, absolutely. Oats and oatmeal, that's fiber. It's a whole grain. It's a fiber food. And that does, any fiber really helps with promoting good bowel function. And when it comes to water, we always hear, drink 6 to 8 glasses of water a day. I will say that sometimes depending on what different conditions people have, they may need to drink less, they may need to drink more, depending on your body weight. But definitely, I recommend drinking water over some of the other drinks, like we talked about, like the carbonated beverages, caffeinated beverages. Those do have a significant impact on your bladder and your bowels.
Okay. Is there any type of person who should not do Kegels?
Yeah, I talked about that a little bit. Really, if you're having a lot of pelvic, a hypertonic pelvic floor, and sometimes people really won't know that unless they go and get evaluated. Typically, someone with a really hypertonic pelvic floor has a lot of pelvic pain, pain with bowel movements, pain with intercourse, and it may just be because the pelvic floor muscles are really tight. And then it's not that you're not doing Kegels, but you're doing a different type of a Kegel. It's not just a squeeze, but you're doing a lot of relaxation and other techniques to help with calming down the pelvic floor muscles. So that would be, and you know, these are great questions, but I would say that if you're having any of these issues, so definitely seek help with a specialist that can really do an evaluation of your pelvic floor, evaluate those systems, and be able to come up with a really great and targeted, individualized plan for you, because everyone's different. And even though we have common therapies, there's things that what works for one is not something that we use for another.
All right. And the last question, do you give virtual consultations? And if so, how can someone get in touch with you for a virtual consultation?
Oh, that's a great question. I do. I'm at Houston Methodist, and so you can actually just Google me at Houston Methodist and reach out that way.
Excellent. Well, Dr. Fee, I will tell you, you got the most questions out of all the presenters. So this is really a hot topic here. And I'm not sure if Karina is here for us to close out for the night, but thank you so much. We are curious about your work in Haiti and what you're doing there. And I don't know if people can go to your website and learn more about that as well.
Yeah, thank you so much for that. And it's been a pleasure being here. And, you know, it's, this is, you know, talking about pelvic floor disorder is an issue that we really don't talk about a lot. And so having this opportunity to be able to speak to all, and I really hope that it's made, it's kind of encouraged you that if you do have any of these issues to go seek help, because I think a lot of times women, we suffer in silence when we don't really need to do that. And so it's been a pleasure to be able to share that with you. And in regards to my work in Haiti, yes, I'm actually, because due to the political situation there, we're actually working in an area in East Africa now, in Malawi. And so happy to, for you all to learn more. You can reach me at flindo@houstonmethodist.org if you're interested in learning more about that.
Awesome. Thank you so much.
Thank you.
Thank you both. Dr. Teddy, thank you so much. This really has been such an incredible series. Thanks to you. And Dr. Lindo, thank you for your unique focus on public health and women's wellness and our unique needs. So you are incredibly aligned to not only serve your community's individual needs, but to provide such compassionate care. And we know our key takeaway is to seek care, and how exciting that people can actually virtually see you. That's incredible. So thank you. You can see more from Dr. Fee on LinkedIn and on Instagram. We put an article in the comment section where you can follow what she did in Haiti, and we'll keep an eye on what she's doing in Malawi. That's fantastic. And let's see, you can also follow her on Instagram and LinkedIn. And I know that Nicole is putting all of those things in the comment section right now. You can find the recording for tonight's program and many others on the Plant Powered Metro New York YouTube channel. Please subscribe so that you'll get a notice when we go live with great programs like this one.
Karina, I just have to interrupt you because
yes,
we have to clap it up for you, because you have been the behind the scenes person putting this all together. So we are not going to close this evening without saying a big kudos and thank you to you for all the work you've done. And we can hear you all clapping from your homes, but thank you. And thank you to Liana and Plant Powered Metro New York, and to the HeartSmarts community for their awesome participation during this entire series. So you all have been amazing as well, and thank you for joining us.
Thank you.
It's just been so great. Thank you, Dr. Fee. That's amazing. I'll thank a few more people if that's okay. Special thanks to our team members at Plant Powered Metro behind the scenes: Grace Simino, Nicole Cholet, Hannah Martinez, and Jim Spellos for making all of this popular. It sounds like NPR, where they go through every single person who helped with this. And of course, Dr. Naso Lotetti and the HeartSmarts community. Awesome participation. So I think I have a little link here for last week's recipe booklet from Dr. Fontaine that got us eating lots of protein. And now we know that that also helps with below the belt as well. So maybe Nicole will put that also in the comment section. We'll definitely put that in the follow-up email. That's why it's always great to register online with Plant Powered Metro if you can, because then we make sure we send out a pretty big thank you for joining us email with all the links that the doctor spoke about. Looking forward, we invite you to join us for a hybrid event that's in person and online. It's called Your Spring Toolkit for Achieving a Healthy Weight for You with New York City internist Dr. David Deneyev. You won't want to miss this. He's very funny. It takes place on April 1st, and I believe that is also in the comments section, but you can go to ppmny.org under events, and you can see that there as well. Please, if you can, consider making a small donation to support Plant Powered Metro's mission. Every bit helps us reach more communities with important nutrition programs across the lifespan. The donation link is also available in the comment section and on the ppmny.org website. That's the shortened one that I use. You can also go to Plant Powered Metro, spelled out, ny.org. So thank you so much for being here with us for 1 or 2 or 3 or all 4 of these great programs. From all of us here in the studio, we hope to see you in our next program, in person or virtual. Best wishes for great health. Thank you, everybody.